We are back on the town hall with your health care and how it could change as COVID emergency measures end. Federal policies and funding that were put in place during the pandemic will soon be rolled back over the next few months, and that includes big changes to telehealth, testing, vaccines, and Medicaid coverage. So during COVID, millions of New Yorkers were allowed to stay on Medicaid without any type of scrutiny. But starting in April, they will have to be reevaluated to stay on the program, and that could interrupt their health care coverage. A recent article from Gothamist and WNYC Radio explained how it's going to work. Today, we spoke with the author, healthcare reporter Caroline Lewis, about the impact.
So I think, the biggest change is just that people might have some disruptions to their healthcare coverage. That is sort of what has been typical, this cycle of enrolling and then maybe, disenrolling when you don't qualify and then re-enrolling, and that can really disrupt people's care. During the pandemic, there was something called continuous enrollment where people didn't really have to worry about that. And now I think they'll just have to pay attention to making sure that they have that health coverage that they need.
Another key change will deal with how a lot of you see your doctors. Telehealth blew up during the pandemic since people didn't want to leave their homes. They didn't want to sit in a waiting room around a bunch of sick people. Well, since then, it has remained popular mostly out of convenience. But when the COVID emergency ends, some doctors will have to change how they operate. Not all, but some. And that includes prescribing controlled substances over the phone or by computer.
That includes a lot of common medications that people use, like Ritalin, Klonopin, and also Suboxone, which is something that people use for opioid addiction. And so I think that there may be a possibility that states may try to re-implement some of those rules to make it so that people can continue, to have that convenience.
Caroline added that some telehealth coverage for Medicare patients will remain in place through at least the end of this year. She also reports that the New York State Department of Health is looking into other telemedicine options, especially for those being treated for opioid addiction.